Hello there. I'm going to tell you a bit today about vaccines, variants, and the risk of long COVID from a number of studies from within the UK. So just quickly disclose that I'm a consultant for Zoe Health, which is a science company behind the Zoe app, which was a not-for-profit initiative jointly between my university and Zoe back in 2020. So here we're going to just reframe and think about the definitions of long COVID. And they are somewhat varied across the world. But back in about October 2020, the National Institute of Clinical and Healthcare Excellence produced a definition, which I think is quite good and is similar to the WHO definition. And what NICE did is, partly because of our paper that we published in Nature Medicine back in 2020, we saw that there's a big difference between COVID-19 disease and other non-COVID respiratory illnesses that presented in the same way, and then people got a test and they tested negative. So we saw that in people that tested negative but nevertheless presented with a respiratory virus, the vast majority of them didn't have symptoms more than 28 days. But in individuals that had COVID, there was quite a long tail, which is here depicted in orange, that had symptoms for more than 28 days. And so that's why the National Institute of Clinical Excellence brought in this term ongoing symptomatic COVID, which was people that had symptoms for more than 4 weeks, but less than 12 weeks. But then they defined, as similarly WHO has defined, more than 12 weeks of consistent symptoms, which are not explained by an alternative diagnosis after an infection consistent with COVID-19. That's long COVID or post-COVID syndrome. And it usually presents with clusters of symptoms, which are often overlapping and can fluctuate and change over time and affect any system in the body. So bearing that in mind, back in 2020, when we published our first paper, we were really keen to see what the risk factors were. And of course, things have changed a little bit since then, but broadly, the findings that I'm showing stay the same, that the most important risk factors for getting COVID are the severity of the initial infection. So people who are hospitalized, or indeed people who had more than 5 symptoms in the first week and still remained at home, they're at increased risk of going on to get long COVID. And that's a finding that has been now replicated across many studies. But apart from that, age up to the age of about 70 appears to increase the risk of long COVID. But after that, very old elderly seem to be less at risk. And that may be partly because they get the infection so severely in the initial stages that unfortunately they die. Female sex is associated with risk of long COVID, and that's replicated now across many studies. And within the national core studies within the UK, we also showed that pre-existing mental and physical health problems that were there before the pandemic were significantly associated with the risk of going on to get long COVID. But of all conditions, maybe asthma came out as something particularly important. So this nomogram here basically was produced before we had vaccinations and in the original wild variant. But broadly, until we get to Omicron, things are much the same, that you can use these 3 factors, severity of initial infection, age, and sex, to actually predict who might be most at risk of going on to get long COVID. So different estimates do change between different studies with maybe with slightly different definitions, different patient groups. So this was something that we did across lots of studies within the UK, showing that really it's around 5% of people who are middle-aged who go on to get long COVID, which affects their function for more than 12 weeks, whereas it's about just over 1% of people who get COVID in their 20s that go on to get this condition. I've told you about some of the pre-pandemic factors, but principally these were the poor pre-pandemic health and psychological distress before the pandemic were risk factors. Symptoms of COVID-19, this was what we put back in the original paper. Really, there's a predominance of fatigue and headache. But when we've looked more recently to try to sort of really unpick whether there are different symptom presentations that might cluster within the long COVID. We have seen that we can identify at least 5 different clusters that machine learning can pull out. But the very largest of which is really this one that's in cluster 1, which are people that have headache, brain fog, anosmia, and dysosmia, and persistent cough, but generally don't have the very wide range of symptoms that some specific people are affected by. And some of the other symptoms, so it's cluster 4, is really a much more neurological type of subtype of long COVID, which I think we're seeing now emerging in different studies. And then there are other subtypes that look much more cardiological. So I think we've all got to bear in mind that there are potentially different subtypes that are happening within long COVID, and more work needs to be done to try and to delineate them and really refine the diagnosis. So you wanted to know about how long COVID has changed with different vaccinations and with different variants. And so this is a paper that we published in Lancet Infectious Diseases quite a while ago now, sort of last year, which really was the first paper that showed that there's a significant reduction in the risk of going on to get long COVID after 2 vaccinations. And we've now seen that replicated, certainly from the Office of National Statistics in the UK and some other studies around the world. Initial studies, there were some small studies that seemed to not find this finding, but I think now there's a significant amount of replication of this finding. So the risk of going on to get long COVID is reduced by having those 2 vaccinations. I'll show you a little bit what happens after a 3rd vaccination in a minute. And I think the thing is that probably what we see is that most people after 2 vaccinations, they have a really good antibody response, which even though it does wane over time, is pretty good at reducing the risk of that early initial severe illness, reducing risk of hospitalization, and therefore reducing risk of long COVID. When you then add the booster on, you do get a big boost in antibody levels. Everybody becomes very much, really very well vaccinated in terms of antibody levels, but we don't see a massive difference in the effect on the symptoms of long COVID. So you don't really see an extra reduction in risk with the 3rd vaccination. Of course, that doesn't mean that we shouldn't be going around and giving that 3rd vaccination, because there are effects on reduction in risk of hospitalization and maybe bringing up individuals that maybe didn't have an adequate response to 2 vaccination. Now a little bit about effective vaccination on the symptoms. So there's been a few studies that have been published that come from really patient groups and sort of online media groups where individuals have been asked retrospectively to report on whether their symptoms got better after vaccination. And of course, they're a bit problematic because ultimately people were not blinded, and many people might report changes in symptoms. But mostly those studies have shown that overall more people reported an improvement in symptoms after vaccination than who reported an increase in symptoms. So we've taken an approach to try and look at all long COVID patients that have logged in on our app and logged prospectively their symptoms over time. And we've compared people who've had the vaccination during illness to people who haven't. And we've tried to match those time points to really compare what happened to time course at the same time in the illness in people that are matched, that have not been vaccinated and who've been vaccinated. And we've matched on age, BMI, gender, duration of illness at that time point, and the test date. And with that, the study's not published yet, but what we do see an increase in symptoms, of course, after vaccination, such as sort of fever and a reaction to the vaccine. But after 2 weeks, if we subset by that time, there's more symptoms that have improved than have gotten worse. And these differences are small, but they are significant. So there does seem to be a little bit of an improvement in symptoms with vaccination if you've had long COVID. and sorry, there's a typo here, it's no symptoms worsened after 2 weeks in our data set. So over the last 2 years, really, we've been producing estimates for the UK based on the Zoe COVID symptom study for not only the incidence of new cases, the prevalence within different sectors of a society, but also the incidence of long COVID. And what we did to do this is we used what I've shown you already, using the National Core Studies data on the age-specific rates of proportions of people who've had COVID that go on to experience 12 weeks or more of debilitating symptoms, stratified by the different age groups. And also the fact that we've got a reduced risk of COVID in people that are vaccinated. So we know what age of people are, we know whether they've been vaccinated or not, and we know what the rates are of them catching COVID. And so then we've been using that to produce estimates of the numbers of people that are affected by COVID that are going to go on to get long COVID on a daily basis. So this is the graph that we had in January. And you can see that it shows this really massive steep rise, and that's because of the increase in cases with Omicron variant in the UK. And then indeed it went on to have a double hump and is now finally coming down. And so I guess we were producing this graph which indicated that the numbers of long COVID cases would be going up very significantly. But of course, that depends on whether or not Omicron is causing the same rates of long COVID as other variants. So that's what we then set out to try and find out. So here, in the past, we've published in Lancet Public Health around the Alpha variant. We saw no discernible change in the rates of long COVID, or really the condition of long COVID in terms of the symptomatology. And likewise with the Delta variant, although it's more difficult to ascertain differences because vaccination came in at that time. But with Omicron, we see quite a different picture. So here I'm talking about a study that is still not yet published, but hopefully will be very soon, where we compared 56,000 individuals that first tested positive between December 20th and March the 9th. So that's the Omicron period in the UK, when more than 70% of people who were tested by genetic testing were having the Omicron variant. And it's mostly BA1 period in this time. And so we compared those 56,000 people to 41,000 or so people who tested between June the 1st and November the 27th, which is when Delta was the most common variant, again, more than 70% of cases. So we don't know, of course, that these individuals definitely had those variants, but the likelihood is they did. And so across a big population like that, we think we can confidently compare. So we calculated the odds ratio of getting long COVID of more than 28 days. We couldn't quite estimate 12 weeks yet because there's not been enough time really elapsed for everybody. But we calculated the odds ratio of going on to get long COVID. And you can see that we've adjusted for sex, index of multiple deprivation, which is our socioeconomic factor. Now we did that partly because actually what's interesting is in the UK, Omicron has significantly more affected people in higher social class residential areas, funnily enough. Not a magnitude of difference, but that's interesting. So we put it into the models to make sure we correct for that. Because of course, social class is very strongly related to lots of health outcomes, as I'm sure you know. But it's interesting that Omicron was affecting those areas slightly more, and that's partly because they're probably opening up now and maybe haven't been exposed previously. So we included analysis adjusting for that, as well as age and the presence of comorbidities and how many vaccinations someone had had, and their body mass index. And of course, as I've already presented, those things are related to the risk of long COVID. So when we adjust for all of those things, you see that in all stratifications by how long people have been since their last vaccination, we see a significant reduction in the risk of going on to get long COVID with Omicron, of at least half. So that sounds very good, but of course the problem is that we've had at least double the number of people affected by Omicron. So unfortunately, it means that actually within the UK, the numbers of people going on to experience long COVID has probably actually gone up rather than gone down. This is the Office of National Statistics graphics that they've put in just today, that they show, like us, that in people who have been double vaccinated, there's a significant reduction in risk. Interestingly, they didn't show in people who've been triple vaccinated an additional decrease in risk of long COVID. And they did show a little bit of a difference in terms of the risks of going on to get long COVID with the BA2 variant compared to the BA1 variant, where there was a significant difference in the risk. And you can see that it's about 8.5% of people with BA2 variant that were affected by long COVID versus just less than 8% of people in the Omicron BA1 variant. So here's that slide again with the numbers in the UK. I'm sure in most of Europe, it's somewhat similar. And so even though there's a reduction in risk in Omicron and a reduction with vaccination, unfortunately, it's not the time to be decommissioning services for long COVID across our nations. So thanks very much. And I look forward to hopefully seeing you in the question and answers.